a dental hygienist for about 25 years. And most of the time I've spent it as a clinician in a private practice. And I've absolutely loved it. It is fun to be able to meet new people, to be able to educate them about their health, and then to be able to see them respond to that and improve their health. I have asked some of my friends and colleagues to share with you some of their feelings and advice about dental hygiene, and I hope that you come to love it as much as we do.
I love dental hygiene. Private practice is so much fun. So much fun to treat patients, so much fun to go out and do all day long the things that you've been talking about doing, and being in clinic from, half a day here to going into practice and actually doing all day long what you love to do. It's great. You will love it. It is so much fun and so rewarding.
It's a great profession. I love it. I love dentistry. I love it. I think it's an exciting time to be a dental hygienist.
Hygiene is wonderful. It's the best job. You get to have whatever days a week you want. 1, 3, 5. You can do that. You get compensated very well.
We in my country don't have hygienists, and to me it's a blessing to be able to have this license and to be able to work as a hygienist.
Just enjoy your time. Hygiene is fun. The patients are great. I love it when I'm in an office for at least 18 months, and then I know my patients, I know what they need, I know who they are, and I grow to love my patients.
I was always really interested in the health profession, but I didn't want to be up in the middle of the night working at a hospital, having weird hours or anything, and so I got into dental hygiene.
I really love what I'm doing, and I love my job and the people I work with. I love my students.
Great profession. You guys made a good choice.
When we first come out of hygiene school, we are not with a great speed that maybe is needed in regular practice. You come from seeing 1 patient or 2 patients a day to seeing 8 patients a day.
Trying to be thorough, not miss anything. So that was probably the biggest challenge to transition to private practice, but practice makes perfect and you will catch up.
Obviously time is the biggest one. And then the other thing is that there tends to be a lot of, you think of dental hygiene as so cut and dried, and dentistry is so cut and dried. And what you realize that there's a lot of room for negotiation when it comes to different policies, procedures, diagnoses, and you have to figure out how to adapt what you learned in school to what's real life.
Luckily, we had a hygiene assistant, so she did all the writing in the charts. She cleaned up the operatory, she did the sterilization and everything, so that was really helpful to have that speed things along.
I was lucky because my office was understanding that I was new. So whenever I got a little behind, there was always an assistant or somebody to go help, maybe take the radiographs of the next patient, or maybe they schedule my schedule a little bit longer per patient the first few months until I got at the right speed. So that was the difference that maybe at first gets you a little nervous.
So be patient with yourself, be patient with your staff, be patient with your dentist, and ask them to be patient with you.
Another nice thing about hygiene is just your time, your schedule. That's the greatest thing about hygiene is we work an 8 to 5, Monday through Friday. Maybe that's worst case scenario is working 5 days a week. It never happens unless you want it to.
Pretty lenient with an hour. That is more than adequate for most people.
I usually have 45 minutes per patient. Unless it's a new patient, then I usually have an hour.
I work just half a day or 3 days a week or 5 days a week. You will always find an office that will have those needs, and you will be able to make up your schedule.
But it just gives you a great opportunity as far as making your own schedule. You know, right now I work Tuesday through Thursday and 2 Fridays a month. That's perfect, and that's exactly the number of hours that I want to work. And I have a lot of freedom with that. Also, you kind of decide how much you get to make depending on how many hours you work. If you want to, at one point I was working 5 days a week, sometimes 10-hour days, because that's how much I chose to work at the time. Now I'm choosing to take it a little bit more easy. When you do go in for interviews, make sure to ask the doctor what he expects to pay, and then if that's too low, then you can negotiate higher. But always allow him or her to say first, so that you're not coming in with too low of a wage.
Some doctors will pay you a flat rate, maybe from 30, 35 to 40 or whatever. And some others will maybe give you a base pay and do a 30%, how do you call it, production day.
Yeah, I usually research the wage online, see what the area is, or I'll call a couple of different offices, just kind of acting like a student or something and asking what their pay rate is, just to kind of get an idea of what I should ask for when I go in for an interview. That way I'm not like asking some outrageous fee or going too low. A doctor who had gotten my resume from years previous contacted me and offered me a higher hourly plus an insurance benefit. And I took that to my doctor and let him know that was the situation at hand, even though I loved working for him, that I had to do what was in my best interest, which was get paid more and have the insurance benefit. And he said, let me think about this. Next day, he brought me into his office and said, I'm willing to pay you even more than he's willing to pay you, and I will also give you an insurance benefit.
He actually offered me more than I asked him for. He said, well, I feel like you're actually worth a little bit more than that, so I'm going to pay you this instead, because he felt like he really loved the new, fresh out of school, my new ideas. He's a younger doctor too. I think that tends to play into it a little bit. But
sometimes right out of school, it might be appropriate to actually take a little bit lower wage. And that's just if you feel comfortable. Sometimes the doctors will give you kind of a trial period, and that takes a little pressure off of you, knowing that it's going to take you a while to get up to speed.
But there's a good chance that you might just have to take whatever to begin with, and chances are it's going to be a little bit lower because when you're fresh and you don't have the experience.
Of your doctor, but definitely get that in writing. And then other offices may actually want to pay you more because you're fresh out of school, because your new ideas.
You get things in writing as great and as friendly and as honest as the doctor may be. Oftentimes they just forget.
Or you want to get things in writing about your wage and benefits.
There's a variety of ways of, paying. So find the doctor that you like and that maybe pay according to your needs, or negotiate. Maybe see if he will give you raises every 6 months or once a year.
But don't ever be afraid to ask for what you think is reasonable. Also ask your other hygiene friends, see what they're getting paid so that it's comparable. You don't want to do anything outlandish or expect too much, but do ask for what you think is appropriate.
Well, in real life, sometimes you find an office that's perfect, but the room that you work in is not perfect. You might be in tight quarters, you cannot do your clock positions like we insist you to do, but you find a way to make adjustment and work around it.
Really watch that, or you're going to go home so tired. Your hands are going to be tired, your back's going to be tired, your neck's going to be tired.
I suffered a back injury doing nothing more than lifting dishes. But what I found is, as an assistant, ergonomics were not something that we were taught to be concerned about. And as hygienists, it's something that we know we really need to watch very carefully. And so I would encourage all of you to make sure you have your patient move toward you, have your patient put their chin up, and things like that to make your ergonomics better, so that you don't have to endure some of the pain and suffering that I have. And
Talking about ergonomics, the biggest thing that I found is a good operator chair and just knowing where all of your things are.
I like to sit most of the time at like 11 or 12 o'clock, and they always have like a big thing right behind me, like a cabinet or an ultrasonic unit. And so when I get there, I either have to tweak, which I learned quick after my first job that I can't do that.
Just do your best to work with that, and so you don't hurt at the end of the day.
When your instructor comes over and says, oh, watch your neck, just know that they're looking out for your well-being 10, 15, 20 years down the road.
Dental hygiene, I've been in a few offices where it really, really works, and they have a dedicated hygiene assistant, and things really do work smoothly, and some hygienists love it. The one downside with double hygiene that you need to watch out for is that you're constantly scaling. You're pretty much going from room to room and just scaling, and that can kind of wear out your wrists and your hands.
You know what? I did double hygiene one day in an office and my hand hurt for a couple days. I really am not a fan of double hygiene myself. I feel like it's nice to have the time to get up, move around, talk to your patient, do the OHE and do radiographs and stuff like that, because it gives you a little bit of break. You're not just sitting there cranking with your hand in that tight position all day.
It's a good, I like it sometimes and sometimes I don't. I like to have the break and do my own x-rays and to be able to clean my own room, to let my hands rest for a little bit. That's my big thing, is when I'm going from room to room, doing double hygiene is a little bit harder on my hands.
And I know some hygienists that worked for a doctor that did double hygiene. They had the assistants polish. All she just came in was, she just came in and did the cleaning, and the hygiene assistant sat the patient, did the OHE, took radiographs, cleaned up, polished, flossed, everything. And she had carpal tunnel and had to quit.
If you are working double hygiene, you need to ask for a higher pay rate as well.
I temped for about 6 months right out of school, which for me was great because I was able to save money just to go on my humanitarian trips and also figure out the type of office that I wanted to be in. Because at that time I had no idea, and doctors had all different types of philosophies, and so
What I really like about it is the networking. You get to know a lot of people, and you get paid to do it. And it's interesting to see how different offices handle different situations. Some things I've found I've brought back to offices I've worked in. Other things I've found I've been really grateful for where I have worked, because things went much smoother where I was.
Temporary gave me the job that I needed until I found an office that I was going to settle in. It gave me the opportunity to see how I actually work in different offices. You find the offices that are the more modern and up to technology, up to date, and you'll find the ones that are still in 1923.
Temp first, if you can. If you can temp all over in a bunch of different places, then you'll find where you fit the best. Because you need to fit into an office that works for you.
But the networking is really fantastic, and have made some friends that way, and have had several job offers.
the doctors would usually offer jobs, and if you wanted to take them, you could, and if you didn't have to. But it was just a good experience. Make a little bit of money and try some different things out. Have a lot of free time.
And I think it's important before you go in and start interviewing and doing working interviews and thinking about accepting a job that you determine what are your top priorities in the practice that you go to. I've worked in a lot of different offices, and I would say some of the things that are the most important to me are the philosophy of the practice and putting patient treatment first always, which is sometimes easier said than done, and working in a team environment.
So I've always had a really holistic approach to hygiene, and I've always kind of believed in that and kind of come from that and really treated the patient as a comprehensive patient. And
I like smaller practices where everybody's friendly and we work together well.
Even if you just have to take any job at the beginning and you don't really have an option or something, if you're not happy, just keep looking. There's really great offices out there, and there's really bad offices, and I've worked at both. And eventually you'll find somewhere you really love.
If you don't like an office completely, there's always great things that you might like about it. And you can bring your own good ideas and good knowledge and help them even get better.
There are things that you'll run into that are difficult, and some things you can work with and be happy, and other things you have to decide, am I willing to work here with these things that I'm not completely comfortable with, or should I continue to look for something else? Which sometimes can be a hard decision.
So hopefully you can have that luxury of finding just the place that fits perfectly for you. You feel comfortable with all the people in the office, feel comfortable with the doctor and his dentistry, and you'll be able to be there for a long time.
When I hired, I liked it when the hygienist actually walked into my office and I could see her and meet her and talk to her. And just sending out 50 resumes is not going to do it for you. Be personable, be proactive, I guess that's the word. Go into the office with your resume, and remember, the front desk lady is key. The office manager is key. If she likes you, you're already halfway there if there's a job available.
You're going to an office to do a working interview, make sure that you're really friendly with the front desk, that you're trying to help them, that you're helping the assistants, and then they'll do the same for you. If you need someone to jump in and do a polish for you or that, then it works out really good.
Go into an interview, act professional, and ask for what you need. Make sure you have a two-way conversation back and forth with the dentist.
We're in a very severe economic situation right now. So when you go in to ask for your job, don't make it all about money.
Don't go to your interviews in jeans. It's old people like me are the ones doing the hiring, and it puts them off immediately. My son was trying to go out and get a job the other day, and I had to talk him into wearing dress pants. It's like, people don't do this. I was like, I don't care. The people that are doing the hiring are not from your generation, they're from my generation, and you need to dress up and look your best, and don't show cleavage.
You should have a good personality. You should smile and be a people person. You're selling cosmetics. Dentistry is a business, so your smile should be nice. If it's improve it by bleaching your teeth, bleach your teeth white.
First of all, they have to have a great personality, because the patients, that's the main person the patients deal with is the hygienist, and they see them the most often.
The hygienist is the first person the patients meet generally when they come into an office, and if they don't like the hygienist, they change offices, and it doesn't matter what the dentist does. The dentist is the guy that goes from room to room and gives them pain, and you're the person who's supposed to make them feel like they're part of the big office family.
I would always call patients after their scaling and root planing appointments and just see how they were doing. Make sure that they were okay, ask them if they needed anything, talk to them about post-op instructions, and patients always really appreciated that.
Probably the ability to make patients feel comfortable.
The theme was call someone by their name. So you learn the patient's names, and the next time they come in, you call them. Oh, hi Jack, how are you doing? And you've made little notes in your folder, in the chart, that they didn't know you made. Things like their child just won the track, their grandson just won a scholarship or something like that. And you say, Jack, how's your grandson doing with that scholarship he just won? People love that. People will learn to love you very rapidly if you take an interest in them.
I always kept personal notes on all of my patients, so that the next time that they came in, I could say, hey, how was your daughter's wedding? Or how was your trip to Disneyland? Or those kinds of things. And patients love that. And the closer that you can get to them and build those relationships, the more they listen to you with treatment that you recommend. And just the better morale that you have in the office, which also makes private practice a lot of fun.
But hygienists are a key part of the office. It's the biggest. They're the biggest asset to helping patients accept treatment is the hygienist, because then they're the first ones to prepare them for what they need to have done. have excellent clinical skills and judgment. That's the thing that I notice the most, and the thing that's probably not the thing the patient notices the most, but it's the thing that I notice the most is the clinical skill and judgment in what they do.
Hopefully, you will continue to strive to be really thorough in your cleanings. The patients appreciate that. I would hope that nobody would get sloppy or think nobody's going to check this and nobody will know the difference.
You have a choice to be 100% in your private practice by continuing to do the blood pressure, continuing to do your cancer screenings, continuing to probe. Those are very, very important things.
Don't slack off. Sometimes when you get out into practice, you're just so overwhelmed. So don't slack off as far as infection control and sterilization and all of that. So just really maintain your standards that you have here.
Clinical judgment and being able to explain things well to patients is a huge, huge asset to an office. And it prepares the patient for, to be able to accept treatment and to be able to have the hygienist know exactly what they're talking about and be knowledgeable of what they're talking about. It puts a lot of confidence that the patient has in the hygienist and the rest of the staff as well.
That's teamwork. Be a member of a team.
I have a lot of hygienists that are really great. They'll just, they come up and help check for their patients. They see if there's anything they can do to kind of help the assistants, and even sometimes go numb for the doctor if he's got a problem and he can't get, the patient quick enough.
They have to be able to get along well with the other staff as well, because they.
I think what they said too. Be a team player. Don't act like you're above everyone. I think if you are a team player and help the dental team that you're around, it'll be fun. I mean,
Please don't be a prima donna. Those hygienists that won't help take the garbages out, won't help make phone calls, that really won't work as a team, really make matters difficult for themselves, for the people they work with, and really generate a negative feeling around them.
So the office that I worked in, everyone was a team player. There were times if my patient canceled and the doctor was behind, I would go assist or set up and tear down rooms or work in sterilization or confirm patients for the next day or send out recall cards or see if I could help with filing.
Just make sure you pitch in, make sure you're friendly with everybody, don't feel like you're above them, and work really well with the office manager because it'll make everyone more happy.
Be a team, be a helper in your office. Doctors actually, more and more, I see that are encouraging the office to be all as one.
And the most important thing in your practice is making sure that there's camaraderie and that people get along well with one another, because that's what I love about working here is we all get along great, and we've all had experiences where even if there's just one bad apple, it ruins it for everyone. So it's really important just to remember not to be that person yourself.
The worst thing in offices that I found is when you get one bad apple. It ruins the whole office. So just be happy and do your job. Communication is the key. If you can communicate, then you're gonna do fine.
I think some of the other CIs have talked about one bad apple can ruin the bunch. So just having a good attitude. Don't be a prima donna. Don't be afraid to do anything. I mean, I've literally cleaned baseboards at offices when I had extra time.
Just always come to work with a good attitude and be willing to help in whatever aspect that you can, even if it's not your hygiene job, make it your job.
Technology, I think, is pretty neat. I think that dental hygiene students coming out are going to have so much more opportunity to do incredible things that other people haven't been able to do. There are things from a range of microscopes where you could show your patients their plaque. There's periscope. There's perioscopy, which is it lets you use a microscope to watch yourself scale, which is amazing.
I've worked in a lot of offices with technology, which has been my passion. I've worked with lasers, I've worked with intraoral cameras. We always did what we called case conferencing, so the whole office staff would sit down and look at pictures and talk about patient treatment plans and prioritize patient treatment, so everyone was on the same page.
I think just even having computers in each operatory where you can actually just zip on and look up the latest medications without having to sit there and try and figure out what they are in a book.
Also, if you do a lot of perio, the isolite. So it's a clear bite block, and it has a little tail that's also clear that suctions for you, and it lights up the mouth. So it's a bite block, a light, and a suction, and it's awesome for those people with really big gag reflexes.
Technology, I really love digital x-rays. I think they're fantastic. I like their intraoral cameras. If you're lucky enough to get those, they really help that patients see what you're looking at.
Digital x-rays and digital photography and intraoral photography are things that I would never have thought of when I was back in hygiene school. And it really helps to communicate with your patients, so I think that really increases case acceptance as well as it helps improve their confidence in you as the clinician.
You can use the intraoral camera to take a picture of that big bridge of calculus and show the patient the tissues, all the inflammation, and then next time when you finish cleaning everything, the tissues are better and all of that's clean, and you can take one when it's beautiful and nice and show them the difference. It's awesome.
Behavioral, there's some really neat programs out there that'll help you decide how much risk a person is at for further or new bone loss.
I would talk to the patient and recommend perio treatment over and over for 5-6 millimeter pockets, calculus, bleeding. These patients had been coming in on a 6-month recall for years and never heard anything about periodontal disease. So I would prep them for perio treatment. The doctor would sit down and say, "Everything looks good, we'll see you in 6 months." And it was really a challenge for me. Brand new out of school, thinking I was doing the right thing, and then questioning myself at the end of the day. I took my concerns to both the doctor and to the front office and assistant, and we ended up working through things to where we did give perio treatment to these patients that needed it, but it was through presenting information, new research, my knowledge to both the doctor and owners of the practice, and then I felt like I could work in that practice and I felt good about the treatment that I was providing. But in the beginning, when that was happening, it was really hard. So
I think it's the hardest thing in a dental office is trying to get the front office and the back office working smoothly together, and it helps if you've cross-trained a little bit both ways so that you can kind of see the other person's side of the story.
What I'd prefer the hygienist to do is to contact me first, or if the office has the office manager running things, contact the office manager first, and then they can bring it up in a team meeting so that they're not directly accusing other assistants or other staff about it. They can bring it up to that person and they can address that issue in a staff meeting and just have everybody address the problem and come up with solutions to the problem, so it's just not, being told this is what we're going to do now. Say, how can we solve this problem? This is a problem I see. How can we solve it?
Avoiding burnout. Don't do it. Just if you have to, go down to 1 day a week or whatever. Just keep in the field and then just keep going.
That's always a struggle if you're doing double hygiene. I always worry about burnout when I do that. But I like to have a break in between stretch. I try not to do more than 4 days a week. I have done 5 days a week, and it does lead to burnout pretty quick.
Make sure you work part-time if you need. Continue with your hobbies. That's what I do. You guys all know that I snowboard on my days off, and I play volleyball, and that's what just keeps me enjoying my work.
Continuing education is the key to avoiding burnout, if you ask me. if you're always learning and finding out something new, then it keeps being exciting to you. I thought that if you can find a couple of some of the different conferences and things have different flavors to them. So if you can find one that you really like with people that you really like, then it makes it super fun to look forward to go to that conference every year, and you just get that boost that it just keeps me on high for the rest of the year until I get to go again.
I would really encourage everyone to be very professional and to really work as a team. And working as a team doesn't mean just bending over backwards and doing everybody else's job, but when you've got time available, you do a little for them, they do a little for you. Make sure it's a real give and take, and learn as much as you can about the office and the different workings. It makes you more valuable. The more you can do in the office, makes you a more valuable employee.
I really love the book called The Purple Book. It's written by Shirley Gutkowski, and I can't remember the other author, but The Purple Book is a great thing to get when you're getting out of school. I wish I could afford to give it to all my students, because I totally would, but it's like $30 a copy, and I didn't have that kind of money. But it gives lots of good advice on finding jobs, on finding the right dental fit for you, on how to negotiate wages and those kinds of things.
I would always have a voice recorder that I would start at the beginning of my perio charting and do the whole exam, and then I would go back later and put it into the computer system. Or you could write it later too. But that way you can still have all the information there and track it over time, but not have to spend the time during clinical practice.
All kinds of opportunities overseas that you can, look into. They're looking for American hygienists because they don't have schools over there for hygiene, and they don't have well-trained hygienists, so you can easily get a job overseas for a while and travel and experience while you can. Like, I wish I had done that now that I look back on it right out of school.
Sharpen instruments. I think that's one thing that we forget in clinical practice a lot, is the importance of sharpening instruments. And you will spend so much more time and be so much more unhappy if you are not sharpening your instruments. So I would do that during your cancellation times.
There's so many opportunities for humanitarian service outside of the United States, but also inside the United States. But as a hygienist, you're in such high demand for that. Even if you just go to do oral hygiene education, people are so excited to see you, and those are definitely the most positive experiences that I've had in my career, have been through humanitarian service, even though it was just a week or 2 weeks.
I think that everybody worries about what the job market is like, what it's going to be like, where there's more students now graduating than we used to, and more women staying in the workforce now than they used to. And I have to just really say that everybody is so scared about that, but we're finally starting to get to where we're almost meeting all of the needs of the public within private dental offices, and it's time for us to get out of our operatories and go out and work in hospitals and nursing homes, in preschools and daycares, in schools, anywhere that people who don't have access to dental care.
Love you guys, and be good, and study, study, study.
I wish you well on your new careers. You've chosen wisely. In this day and age, dental hygiene is one of the top careers available.
Have a great time. Great profession. We'll probably be coming to see you when we're old and decrepit, right, ladies?